This 41-year-old language teacher has committed the past 15 years of his life trying to improve his vision after being diagnosed with keratoconus. He has tried multiple RGPs, has undergone corneal cross-linking and intracorneal ring segments implantation in his right eye. And with this final poor visual acuity, a DALK was his only other choice. However, he thoroughly refused that idea. His vision improves with refraction to 20/50, and with a pinhole occluder, he sees 20/30. We then decided to perform a clear lens extraction, followed by IOL and primary pinhole implantation. After IOL implantation in the capsular bag, the pinhole was dialed into the ciliary sulcus. This is how it looked at the end of surgery. In spite of great improvement, he was still complaining of ghosting with his uncorrected vision. This annoying symptom vanished completely with spectacle correction. However, he did not tolerate glasses due to an anisoconia. After proper counseling, we decided to address this situation surgically. 4 months after the initial procedure, we would do an Iol exchange under the intraocular pinhole to a high-seal, toric, power-adjusted IOL. The intraocular pinhole was carefully folded and explanted through a clear cornea incision. The capsular bag was reopened with deliberate use of dispersive viscoelastic associated with blunt dissection. The IOL was freed of the fibrosis and was dialed out of the bag, folded, and explanted. A capsular tension ring was used to ensure complete capsular opening and better force distribution to the equator of the bag. The toric IOL was then implanted and aligned. The same intraocular pinhole was then re-implanted, and this time we positioned it inside the capsular bag. This is the aspect of the eye at the end of surgery. The following day was a memorable day. The patient was overjoyed, referring an unprecedented, very sharp vision. His uncorrected acuity was 20/16. He's never seen like this in his entire life. Under infrared biomicroscopy, we could appreciate a very well-centered IOL behind the black pinhole, with the toric marks properly aligned. This time, he could finally see his writings. In conclusion, intraocular pinhole implantation may significantly improve vision in patients with irregular astigmatism. The synergistic effect of a toric IOL may take this benefit to another level. This combination may be a true paradigm shift in the treatment of keratoconus.
What a beautiful case. Dr. Bruno Trindaggi combines innovation, elegant surgery, and thinking outside the box, all characteristics of the talented Trindaggi family. In managing this case of irregular astigmatism of keratoconus, you get to see a clear lens extraction, a small aperture lens in the sulcus, an exchange using the Ernest technique, reopening the capsular bag, a CTR, toric lens implantation, and a small aperture lens placed into the capsular bag. And then you get to see a detailed view of the fundus. Congratulations to this Brazilian dynasty. Next video, please.